It is a disease that is 90% curable if detected early. There is no better time than now to get screened for colon cancer.
That's right. Borland-Groover Clinic is dedicated to educating the First Coast on the importance of this disease. Dr. Kevin Comar is a gastroenterologist at the Borland-Groover Clinic. Thank you so much for being here.
Good to see you.
Thank you for having me.
90% curable.
Yeah,
That's an amazing statistics.
It's incredible. It's actually incredible.
But the key is what?
You got to get checked, and that's the key. Completely preventable, easy, quick procedure. You just got to get checked.
Who is typically at risk for colon cancer? Who should be going in at what age to get screened? And we'll get into the screening coming up in a second.
You know, the truth is that everybody's at risk. The majority of patients who are diagnosed with colon cancer actually have no risk factors.
Wow.
The risk factors that we know increase your risk are things like age, being over the age of 50, family history, obviously if you have a member in the family who's got colon cancer, personal history, individuals with previous breast, ovarian cancer are at increased risk. You know, lifestyle, if you smoke, if you have a high fat diet, low fiber diet, those types of things typically increase you at risk for colon cancer.
And can we talk about exactly what is colon cancer? And because you do have I'm confused. Do you have a large intestine, a small intestine? Like, is there a particular place where it might occur?
Yeah, I mean, colon cancer is basically cancer of either the colon or the rectum, which is the large intestine.
Okay.
It typically occurs when you have the cells that line the colon, they develop abnormally. The abnormal growth leads to a tumor, then soon leads to cancer.
And when you talk about having a family history, because I lost my grandmother to colon cancer and she was in her 70s, early 70s. So is that something that I should be concerned about and then therefore should come in earlier to get screened for colon cancer?
Definitely. I mean, they recommend that if you have a family history of colon cancer that you be checked at the age of 40 or 10 years prior to the diagnosis of the family member who was diagnosed with colon cancer.
And previously on the show, we had a lovely woman. She came on, Jan Pratt. Her father passed away from colon cancer at a fairly young age, and then she got colon cancer at 35 years old. So really, really young for her.
Yeah, I mean, that's very abnormal, but it does happen. That's why it's really important not to ignore any symptoms. Obviously, symptoms like weight loss, blood in the stools, change in bowel habits, things like that, you have to take seriously.
Yeah, and she said she would not be here if it weren't for the Borland-Groover Clinic. Let's take a look.
The Borland-Groover Clinic helped save my life. If I hadn't gone to them and gotten screened, I wouldn't be alive today. What I like about Borland-Groover is they have their own facility. So you go there, you get it all done there. It's not like you're having to go from one place to another place. I think that they're the kings of colonoscopy in Jacksonville area. So I mean, what can you say? I mean, that's their market. I just am trying to get people to be aware of colon cancer. If I hadn't had a screening, I would not be here today.
Wow. Well, you like that tagline. You should just be Borland-Groover Clinic,
yeah.
The kings of colonoscopies. She actually has an annual event where she raises funds to get the word out about screenings. She has run a 5K at the beach that she's super excited about. So let's talk a little bit about her whole message was, you know, getting early screening, but also I think what dovetails off of that is prevention. Mm-hmm. Are there things you can do to help prevent this? You
know, screening is the most effective way of prevention. Obviously having a good diet, high fiber diet, not smoking. But the truth is that most of this is genetics. And if you want to really decrease your risk for colon cancer, you just have to be checked.
Okay, so let's get into the screening, because a lot of people think to themselves, I do not want to do that. That does not sound pleasant at all. What do you tell them?
You know, the test is a very short outpatient procedure. It lasts anywhere from 15 minutes to 30 minutes.
That's it, 15 minutes.
15 minutes to 30 minutes. Patients are sedated. It's safe. It's comfortable. Most patients wake up 30 minutes afterwards. The whole thing's done.
So they're asleep?
They're asleep.
Okay, so and you don't remember anything. You just go through the procedure, come out, and that's it.
And that's it.
I've had it done before because I was having some stomach problems. So we went in to check, and you're gonna laugh. They give you these cool pictures of your colon, of inside your colon, and it's your intestines.
On the wall when you get
home.
And
it's very interesting because you saw some of the digital stuff on the video, and you do get to see it. So you see that it looks healthy, and they show you what you're looking at, and it's very informative. I found it a very educational experience. It's the prep that is not so fun.
Okay, what's the prep entail?
The prep is you have to drink, I should say, a volume amount of stuff the night before. It kind of cleanses you out. You know, the prep's actually improved tremendously over the last few years. And while the prep's you know, I always tell my patients that prep's not the most uncomfortable thing, but if you have to get it done only once every 10 years, it's not that bad.
Yeah. At the end of the day, if you're thinking about saving your life,
Yeah.
a 15-minute procedure and maybe some stuff that you know might not taste so great, but get over it and do it, right?
Exactly.
All right.
Exactly.
So you're going to get in there and get yours done?
Well, yeah. Well, oh, yeah, since
You have a family history, you heard.
It
so,
is true.
yeah.
Now
Something
you
should
said
get done.
age 40 because she passed away at 74. But you think I should come in this afternoon or what?
No, I think you'd be fine at the age of 40.
Okay, all right, okay. Just making sure. I mean, you are the doc after all. All right, and thanks to Borland-Groover Clinic for sponsoring this segment. You can learn more by visiting their website, which is
Borland-Groover.com. You can also give them a call at 904-398-7205.